Story we've been following closely. Hospitals from coast to coast being overwhelmed with a surge of respiratory viruses, especially amongst young children. Thanks for joining us, everyone, on this Thursday. Welcome to Western Mass News at 5. I'm Chris Pisano.
And I'm Mary Wilson. It's causing emergency departments to fill up, including some throughout the Northeast and here in Western Mass. Western Mass News reporter Kristen Burnell joins us live after getting answers on what local hospitals are seeing. Kristen?
Chris and Mary, I checked in with hospital managers today to find out if they are seeing more children come into their emergency departments in recent weeks. Emergency departments at hospitals from West Coast to East Coast are seeing their emergency departments fill up as respiratory viruses continue to surge.
We have definitely noticed the acuity going up and the volume going up. We've had more pediatric transfers in the past few weeks than we usually do.
On a local level, Cooley-Dickinson Hospital tells Western Mass News they are seeing an uptick in sick children with respiratory illnesses coming into their emergency department over the past few weeks.
We are seeing sick kiddos, the respiratory illnesses that are out there. We're seeing a number of sick children, and we don't admit pediatrics here at Cooley-Dickinson. So we stabilize, and then we need to ship the patients or transfer the patients to another hospital.
Nurse Director of Emergency Services, Sarah McEwen, tells us those young patients are sent to Connecticut or Bay State Children's Hospital. Meanwhile, the pediatrician in chief at Bay State Children's Hospital tells Western Mass News they still have capacity at their hospital and says in part, quote, RSV is rising quickly, but not quite as predominant as rhinovirus, enterovirus, and adenovirus, which are also surging. Bay State Children's Hospital today is 85% full, with 1/3 of cases from respiratory disease from all of these viruses. State Representative Brian Ash, who is also on the state's Public Health Committee, tells us he is aware of the challenges that local hospitals are currently facing.
They're really getting hammered from eastern part of the state, too, with lack of beds. So I want to make sure that they don't run out of beds and we don't have any issues where they're having difficulty caring for these young patients.
And he says he is continuing to have open conversations with those hospitals.
I was just speaking with representatives from Bay State earlier today. So, anything the state can do, but this is something the hospitals are going to keep us abreast of the situation, how it's going, if it's spiking more, if it's coming down, or if they're really in dire need.
And the manager of infection prevention at Cooley-Dickinson shares this message.
Call your pediatrician first before you come to the ED. Very often, early symptoms can be resolved with a call to the doctor, your own provider who knows you and knows your child. And we want to save the ED for people who are seriously ill.
Now, Cooley-Dickinson also tells us that they're continuing to deal with staffing shortages in their hospital as well. Reporting live in studio, Kristen Burnell, Western Mass News. Chris.